Hi, good afternoon, everyone. I'm really excited today to welcome Melia Perrizo. She is a physical therapist and she specializes in pelvic floor. So she was on last September, I believe, and we had so many awesome questions. And let me see, they're in. So welcome, Melia. Let's see if she's able to get in. There she is.
Hello. Let me just make
Hello.
sure.
Welcome, Melia.
Thank you.
It's so nice to see you. Oh, did we lose you? Here we go. Let's see if we bring her back. There she is.
Okay. Technical difficulties, right?
You always just have to roll with it on Instagram.
Right.
But I was giving a little introduction of you. So Melia was here, I think it was last September. I can't believe it's been that long.
I know.
She is a physical therapist, and we were talking about pelvic floor. So let me just give you the proper introduction. You're a physical therapist specializing in orthopedics and pelvic floor dysfunction. You combine these two specialties for your main passion of returning postpartum women to fitness and activity safely. You use a one-on-one approach to address body mechanics, pelvic floor, breathing, and posture to help with urinary incontinence, pelvic pain, low back pain, diastasis recti, and pre and postnatal care. That's a lot of things.
It is a lot of things. It's a lot of
Yeah,
things that women need help with, though, as well.
it is. And so you are kicking off what I'm calling our self-love week here at Elaine Wellness, because I think too many women in our culture neglect themselves and put their own needs off to the side. And I know, as being a Pilates instructor for the last 16 years, I see a lot of pelvic floor dysfunction. And I think a lot of women are too embarrassed to ask for help or even know that someone like you is out there in the world to help women. So tell us, just get us up to speed again. What is the pelvic floor and why is it so important?
Right. So we discussed last time a little bit about pelvic floor. So I brought my model again. Let me see if
Yeah.
my screen is, let me see if this will go away.
Uh-oh. Think we lost her again. I've done that when you touch the wrong thing, it takes you out. So she will hop back in here. So let's see if she can. There we go. Okay. Coming back.
Okay, I'm back.
Yeah, I've done that. It's so touchy.
Pushing
Anyway,
all the wrong buttons, yes. Okay,
yeah,
so back to the pelvic floor. So
yeah,
what I like to also say is that it's really not just a pelvic floor, but it's a pelvic bowl. So
yes.
if I were to kind of give you the example of, this is the pelvis looking from the front. So this is the pubic bone, this is the spine, pelvis is here, the legs would be here, and then dip down inside. This is all pelvic floor. And pelvic floor is made up of soft tissue, muscle, tendon, ligament, but it has to be really dynamic in order to hold all of those organs and
Mhm.
support all of those organs, the pelvic organs, the abdominal organs, to support. And then it also has to be really dynamic in the sense that it needs to relax and let urine pass, feces pass, parts of sexual function. So if you were to
Mhm.
look from below, the bony structures are really only our sit bones here. The
Mhm.
rest of this is all soft tissue. So all of that is that muscle tissue that really needs to be supportive for all of those structures to occur, to happen. So again, pelvic floor is really a pelvic bowl. It really has this nice hammock to help support all of those organs. And those organs in particular, bladder holds urine, uterus can hold baby, and colon would hold our poop in it. And all three of those sit inside that bowl in that midline right inside. Yes?
Right. Right. So pregnancy obviously puts a big demand on those muscles. And if you deliver naturally, that also places a really big demand. What are some of the other situations that can put a lot of demand on our pelvic floor?
Yeah, so even just as we hormonally change, so as different hormones are coming through our body, pregnancy obviously is a big part of that, but then even as you start to hit perimenopause age or menopause, postmenopause, those hormonal changes can make some differences in the ability to have the same stability of these organs. So these organs are all held in space by ligaments. And if we know that ligaments can start to be affected by hormones, which means they can start to have a little more movement in them, which is what happens in pregnancy, but can also start to happen with some of the menopausal changes. So if there's estrogen changes and that type of thing, then you can start to have some movement in these organs, which then can start to typically with gravity will start to come down towards that pelvic floor, which then means the pelvic floor has to do a lot more work to help support that.
Right, right. So one of the common symptoms we hear is urinary incontinence, right? If you laugh, cough, sneeze, jump, go running, you may leak urine. So are there some other symptoms as well that can be caused by pelvic floor issues?
So similar to what I was just saying is, so you said stress incontinence, you can also, which is urinary incontinence, leaking. You can also have fecal incontinence. So you can have staining of feces or passing gas without trying to. You can't hold it in. You can have prolapse, which is when the organs actually start to slip down through the vaginal canal. You can have let's see, what else? You could have some pain with intercourse with that, with some of the prolapse symptoms. You can also, what was it? I forget your other question now.
That's okay. Well, I think you can also like low back pain, which I was surprised. Pain, yeah. Last time you talked about low back pain can actually be referred sort of from pelvic floor dysfunction. Is that right?
Right. So if your pelvic floor isn't being dynamic and it's part of our deep core system, then it can lead to some of the issues that you'll see with even hip pain, low back pain, because it's not doing its job as a stabilizer. The pelvic floor is meant to stabilize us and stabilize our core in particular. And so if that muscle truly isn't doing its job, then other muscles of the back or hips will start to take over. And so then that's when you'll see some of the low back pain or the hip pain. And another one with that is some that we talked about a bit of the diastasis, so the separation of the abdominals. And really that's the idea of that core system not working as well. And so if it's not creating enough tension for you, again, some of the low back pain can come up because you're just not utilizing that system as efficiently as possible.
Right. So these are all issues we're talking about of a pelvic floor that's, I'm guessing, is too slack, that has weakness. But when we talked last September, I was really surprised to hear you say a lot of women are actually too tight in their pelvic floor. And why is that?
Right. So the pelvic floor, our body's amazing in it's going to find a way to make things work. And so the pelvic floor tends to be a muscle that says, oh no, something's wrong. I'm going to go into overdrive and help everything. And so because it has to hold up so many of those organs, it tends to go into a hypertone or a shortened position to create that sense of stability for us. So if for some reason, even with pregnancy or with low back pain, if things aren't working correctly, the pelvic floor goes, I got this. I'll take care of it. And so it goes into this sense of shortening almost, where it
Right.
creates a false sense of stability. And that false sense of stability is really those muscles going into a higher and tight position. And so a lot of times what I'm doing is down training that muscle tissue so that you can get better strength out of it. So I kind of talk about it like the length of my bicep. If I was going to contract my full length of my bicep, I have this full range of motion. If I have this pelvic floor that's sitting high and tight, I'm only getting this much contraction and strength out of it. So a lot of times I'm teaching you have to fully relax in order to get a full contraction, right? So the same thing with a cough or a sneeze or jumping or running is a lot of my ladies will come in with, I can't control when I cough or sneeze, and it's because this is all the strength that they're getting out of the pelvic floor. So in order to get that full ability, you got to have that full relaxation to that full contraction.
Got it. So I hope everyone understands, right? Muscles that are short and tight are often, they're lacking strength, right?
Right.
Yeah. So I pulled a quote because I think we were all really surprised in the conversation, myself included. Last time you said, I always start with breath work because the pelvic floor is part of our respiratory system. So help us understand that.
Right. And so the core system, kind of the deep core, truly the pelvic floor responds to respiration, where when the diaphragm sitting underneath our rib cage comes in on an inhale, it pulls air into the lungs on that inhale and contracts. And it basically tells everything below it to get out of the way so the lungs can fill with air. And so what responds is the pelvic floor relaxes in order for that to happen. The abdominals actually relax as well. So on inhale, that pelvic floor drops down into that a little bit of a relaxation or a recoil. And then on exhale, the pelvic floor contracts and helps push the air back out through the lungs. So they work in conjunction together. And so when you have somebody who has a impaired respiration, so these are my ladies who have either high anxiety or even from pregnancy, diaphragm's been pushed up. Now we start to chest breathe. And you're constantly up through here. That pelvic floor never gets that same recoil of full elongation to full contraction. And so now the diaphragm isn't giving that input. And so we stay in this shortened state all the time, right? So starting with this true diaphragmatic breath is so important. So you can start to get that full range of motion back.
Right. And so I know we live in a culture where everyone's sort of in a fight or flight. People are breathing up in their neck muscles, these very shallow breaths. Now more and more people are trying to meditate. There's books coming out about the importance of breathing. It seems so simple, but can you give us some cues and some tools for how can people start to get that deeper breath and let that pelvic floor relax?
Right. So important. And that's where I think I can give you a lot of cues, but having somebody watch you or watching yourself in the mirror, because when I tell somebody to take a deep breath, it's instantly it goes into the chest and we try and feel
the shoulders.
The shoulders go up. Yes, exactly. And so really trying to picture what the diaphragm is doing, and the diaphragm as it sits under the rib cage is truly contracting and coming down. So on the right side your liver is there, on the left side the stomach and the pancreas. And so sometimes I'll tell patients, really think about that you're massaging those organs down towards the floor. And so one hand on your chest, one hand on your belly, can you get the belly hand to start to move a little bit more than the chest hand, so that that diaphragm is truly coming down into the abdomen, and the abdomen can get out of the way. So it's not that you're pushing the abdomen out, it's really that the diaphragm is telling everything to get out of the way. You can also place 2 fingers right at that perineum, so right between vaginal opening and rectum, 2 fingers there. You can get a little bit of feedback. So when you sit down, standing, anything, and you sit with your fingers there and you take that inhale, you should feel that pelvic floor recoil down into your fingers on inhale, and then you should feel that gentle contraction on exhale. And so if you aren't feeling that, that breath is probably still staying up into the chest a little bit more, right? And so trying to get a little bit more of that almost neural control where we probably have it, but it's just getting it to come back. And so a little bit of tactile cueing with fingers there. You can even put both hands underneath at that perineum to get a little bit of that as well. And really focusing on that.
Yeah, I know. I did a prenatal class for Pilates, and they had us do a lot of work sitting on a gym ball, which that has give and flexibility. So do you think, is that another thing people could do, is to sit on a gym ball and you can actually feel your pelvic floor muscles engage? Would that be a good way for feedback?
That's a great way for feedback. Yes. So the same idea, you should be able to feel kind of that gym ball has nice flexibility to it. So you can sit on that and you can feel that inhale as it kind of comes into the ball, and then that exhale as it comes away from the ball. Sometimes even sitting on a towel roll, you can roll a towel up underneath that perineum as well, and you get that same feedback. And so you should be able to feel that relaxation and then that contraction.
I love this. So this is also a way then, in essence, to practice getting in the rhythm of engaging pelvic floor, letting it relax.
Yes, definitely. Yeah. And really, what I like to tell patients is 3 times a day, check into your breath. So a cycle of 10, inhale, exhale, cycle of 10 of those. And it can be sitting, standing, lying down, doing the dishes, but just so that you're getting that full inhale, exhale with a diaphragmatic breath as opposed to.
Exactly. Well, and I think also a lot of women are so trained to want to hold their belly in. Do you find that? Especially here, we're both in Southern California.
So that is one of my hardest things to retrain is we're so used to sucking in everything. And again, if I'm starting with a shortened abdominal wall too, and I'm only getting this much contraction, I have a lot of high level CrossFitters who, if they are sucking it in the entire time, this is their range of motion for their core strength. To get them to be able to fully release that and then contract, it's a tough sell, but then they come back and they go, I'm so much stronger now that I can use my full range of motion and my full strength.
Right. So the benefits are going to be, obviously, if you're athletic at all, but it's since we're in the week before Valentine's Day, it's also going to help you in the bedroom.
Yes, absolutely. So even for orgasm too, the pelvic floor needs to be able to go into full contraction. And so you have to have the ability to relax to allow penetration, and then you have to be able to allow contraction. And so if you can pair that with that exhale breath and turn that whole pelvic floor on, that contraction can be so much better.
Right. Well, and I would say even breathing during sex, right?
Yes.
That'll make a huge difference for your orgasms.
Yes. It increases circulation. It improves. Yes. It can be so helpful. Absolutely.
Absolutely. So I'm loving the comments here. If anyone has any questions, we don't want this to just be a conversation between me and Melia. So jump in. Don't be shy. She's here to answer anybody's questions. So as women age, what are the important factors for keeping pelvic floor healthy? If as you get through menopause and you still want to have a great sex life and you still want to be able to be active, what are some tips that you would have?
Right. I love that. As you were saying that, I was just thinking I wanted to touch on foreplay, especially because we tend to, if we start to get busy and it's like, let's just get this done and be over with. foreplay actually has a big portion for us with the pelvic floor stuff. So when we're stimulated, what happens is let me grab my model here, is, so this is uterus, cervix is at the bottom here. The cervix actually with foreplay will tent up and almost get out of the way. So some of my women will complain about they have pain with intercourse and it feels like they're hitting something or something's being hit inside. And it tends to be if you're not creating that time before intercourse, that when you are when you have foreplay involved, it allows the cervix to move up and out of the way. So it tends to create more space, okay? And the other part is lubrication. So when we are aroused, more lubrication occurs. As we get older, we start to lose lubrication. And so multiple reasons for us to use that arousal time, that stimulation prior to intercourse, so that we can have less pain during intercourse as we start to age.
Right. And I've heard, I've read things, foreplay should be up to like 20 minutes.
Yes. 20 minutes is, 20 minutes is how long it takes our brain chemicals to really start to trigger all of those changes.
Right. And creates blood flow, right? Can you
Absolutely.
speak to how important, just like men get an erection from blood flow, women in essence need it too, right?
Yes, absolutely. So we have lots of vessels down there, not just blood flow, but nervous tissue and the nerve endings down there. And so the more blood flow that's down there, the more feeling you're going to get and the more pleasurable it will be as well. And so that 20 minutes, it can start in the kitchen with, just a brush of, your back or something. It doesn't have to be 20 minutes in the bedroom, but that thought process starts to make those chemical changes within you so that you can start to get that arousal and that blood flow.
Right. So important. And I think, for a lot of women, we're busy, we're juggling a lot of different things. And it's really important to find sort of that transition space, I think, where you're not going from being at the computer to just rushing to get it done, as you say, right? And I think sometimes we have to tell partners that, I need some time mentally because sex is so much in your head, in essence, that I need some time, or I need to take a bath, or I need something to help me switch gears. And I think it can only benefit both of you.
Absolutely. I would definitely agree. And that's the tough challenge, is making sure that your partner knows too, and having that conversation before you get to that spot, I think.
Right. We had a question come in. How and when should we do those? I think Kegels, right? So talk a little bit about Kegels. A lot of us of a certain generation have grown up reading Cosmopolitan and all these magazines that were like, Kegel, Kegel, Kegel. Just do your Kegels all day long.
Right. And so Kegels is really the pelvic floor contraction. So your body naturally is doing that for you all day, where with that breath, normal breath pattern, there is a slight Kegel happening, right? So that activation of the pelvic floor is ideally something that needs to be very dynamic. So if I were to pick up a coffee cup of, a couple pounds versus 50 pounds, my pelvic floor needs to match that tension to task. So if you do 1,000 Kegels only at 10 out of 10 max contraction, your pelvic floor isn't dynamic enough for all your activities in life. So ideally, you're matching that tension to task with your daily life. So you go to push a heavy door open, you're creating that Kegel right then and there as you're exhaling, pushing that door open. You're going to pick up your laundry basket, you're pulling that Kegel on. So ideally, you're doing it with your daily activities, which makes it that much more dynamic versus here's 1,000 Kegels to do. Um, Similar to if you came into me for a shoulder problem, I wouldn't give you 100 bicep or 1,000 bicep curls, right? It's
Right.
not going to fix the shoulder issue. So the same thing with Kegels. I would prefer you to do it dynamically throughout the day with that
Right.
exhale breath, so that I
Right.
know it's dynamic, so that when you go to cough or sneeze, it turns on the appropriate amount of time, or you go to push something, you have that appropriate Kegel.
Right. So I'm hearing you say we need to practice this with breathing. It's no longer the days of like wasn't it sitting at the red light in your car? You were supposed to just like Kegel like a mad woman or something.
Yes, yes. So yes, ideally you're practicing this throughout your day, not just, thousands of Kegels. And really, again, the focus is, can you fully relax it and fully contract it when you're doing it? And so that's why the breath work comes really into play, is that I
Right.
know on that inhale, you're going to do a relaxation, and then on exhale, you're going to do a contraction, versus starting here and just Kegeling. Yes.
Right. Right. And I want to go back to what you were saying, how, I believe you were saying the diaphragm sits on top of the liver and the kidneys. And I know last time we had talked about, we got a little over into visceral manipulation, which I love, I have done. And just talking about how this breath can help the organs as well. I think people maybe aren't as aware of that.
Right. And so visceral mobilization, visceral means organ, and it really is mobilizing that organ system. And so when that diaphragm, say you go into that fight or flight, that high anxiety, that diaphragm doesn't start to come down into the abdomen. Well, all those organs below it are meant to get this nice range of motion all day long with our normal breath pattern. And if things are sitting high and tight, those organs below it aren't getting that normal movement pattern. And so
Right.
I think about the organs having this nice sliminess to them. It keeps them mobile and moving, and keeps all of the, even for the digestive tract, all of the food moving well through there. And if that diaphragm, which is our main driver of keeping things kind of slimy, isn't doing its job, then those things start to not move as well either. And then they can't do their job as well.
Right, right. So I think our entire conversation today is circling back to breath and how, breathing seems so simple, but it's really the foundation to, pelvic floor health, having great sex, keeping our organs juicy and mobilized.
Yes,
So I'd love
absolutely.
to see. Yeah, does anybody else have any questions? Don't be shy out there. We appreciate you joining. So drop them in the comment if you have any questions, or if any of this is helpful. Karen says, we love the foundational simplicity. Well, good. I hope we can make it so that it's understandable. You added a question to the question box. I might not have seen it. Can you drop it in here? And we will answer it, unless, let me see. Oh, would you recommend using a roller around the sacrum if there's pain around that area? So talk to us. A lot of people have SI joint dysfunction, sacrum pain. Maybe tell us where the sacrum is.
Right. And so turning that pelvis around, the sacrum is that triangular bone in the back that attaches to the spine that's there. And a lot of times people will have that SI pain, which is the sacral iliac joint, this is the ilium that attaches to the sacrum. And so rolling can be great through here. You can use a ball. It just helps with some of that soft tissue. The biggest thing is, why are you having SI pain, is really what we want to dive into. So, which is typically what's happening around it. So the hip muscles around it, the spinal muscles, and then on the inside, the pelvic floor. So
Mm-hmm.
is there a dysfunction where one of those muscle groups is working harder than the other? And what you'll
Mm-hmm.
typically see is some type of hip weakness, whether it's in the hip rotators or glutes, that the pelvic floor then makes up for that hip weakness
Mm-hmm.
and going into that kind of shortened, high and tight position. So
Right.
really the rolling can be helpful, but it's not going to take care of the why. And so figuring out
Got
the
it.
why is the big deal.
Right.
The and that's kind of the go see somebody, go see a pelvic floor PT to help with the SI stuff, because they really will figure out why the pelvic floor is doing what it's doing, why it's creating this tension or torsion in that SI joint.
Right, right. And talk to us a little bit. I think we touched on this last time. Yeah, she's saying from lots of sitting. And of course, we live in a culture where we're all sitting hunched over computers or
Right.
on phones or commuting. So talk to us about too much sitting and what happens with pelvic floor, and is there anything we can do?
Right. So sitting is really a big problem for our poor pelvis, because ideally we should be sitting on the bony structure. So the bony structure again is those small little sit bones here, and the rest of this
Mm-hmm.
again is soft tissue. So when we sit in a reclined position, in that slouch position, we are really
Mm-hmm.
sitting on soft tissue. And so that soft tissue is now getting compressed, where we should be sitting on those bony structures, which is more of an upright position here. So every
Mm-hmm.
time we go back into that slouch, we sit on all that soft tissue. So ideally, in this position, in that upright position, actually all of our pelvic organs are now supported by this bony ridge, which is the pubic bone. They get
Right,
nice support there. There's a nice little ledge for them to sit on, right?
right, right.
Versus when we're sitting here, now our pelvic organs start to slip down into that space. So ideally, we should be sitting in an upright position. Same thing for toileting. The colon is, I'll pull it out here. If it was, if you're sitting upright, it goes here. If you're sitting here, you have to go across a curve, and you have to push a lot harder when you're in that slouch position. So same with the squatty potty, is it puts you in that upright position so things can just slide out versus
Right.
having to push against that curvature.
Wow. Okay, I learned something today as I sit here sort of like slouched down in my office chair.
Yeah. So it is, sitting can be a big problem, you know,
Right.
especially as our bucket seats for our cars as well. We start to sit into this posture as well. So the pelvic
Mm-hmm.
floor just is not in its optimal position to help support all of those organs.
Right. So I think today we learned we need to walk more, right?
Yes. Walk and
And
breathe, which causes you to breathe, to get your cardio going, to get your diaphragm going. Yes.
so who drop in the comments, who is going to go either sit on a gym ball or put your fingers on your perineum and see what your breathing pattern is when it comes to your pelvic floor. I think this is super important. I think it's a really simple takeaway that I hope everyone will use as just a little act of self-love and self-care towards yourself. So Melia, this has been, as always, I learn something from you every time, and you put it in a way that I think we all can understand it, which is phenomenal. So, how can we find you? How can we get a hold of you? Do you do virtual consults?
I do virtual consults, and you can find me on my website. Is basically my first and last name. So Melia Perrizo. It's MELIA PT.com. So, and then you can find me on my Instagram as well and reach out to me there, which is dpt.melia. And yeah, and I do virtual as well.
Yeah, absolutely. She's in. You're in what? San Juan Capistrano?
Yes, my office is in San Juan Capistrano, so South Orange County.
Yep, South Orange County here in Southern California. But if you're not in the area, you definitely, that's one thing COVID has done is we can do more telemedicine and virtual consults. So
Yeah.
I highly recommend connecting with Melia if you have questions. I know I thank you for coming back. It's just been a wealth of information, and I hope everyone takes care of themselves as we go into Valentine's Day. Have a wonderful Valentine's Day, and let us know if you implement any of these tools that Melia has given us.
I hope so.
So, yeah. All right. Well, thanks, everyone. We appreciate you joining. And be sure to DM either one of us if you have any questions. All right. Bye, everyone.